So let's go back to Leonardo and let's it enlarge a little bit. And you have to look very carefully, because the art of diagnosis is to look carefully. Do you know who the best diagnostic person was? Had a medical degree, but mostly known as a detective? Sherlock Holmes. You know, I mean, he could grasp within seconds, you know, looking at and noticing things. And doctors shouldn't be like this. They should have a little bit more time talking to patients as well. You look at these, and what you see here is a little bit of irregularity right here. Next to the eye, let's enlarge this a little bit more. You see it here? And here, you need a good doctor. I mean, you stand in the Louvre before this painting, and lots of people do, you don't see it. And you'll see another example, it's difficult to diagnose, to have a look for that. And here on this side, you see a lesion which is comparable to this. It's not in the same position, but these are called xanthelasma. In xanthelasma, these are sharply demarcated, yellowish infiltrations, and they are deficits of cholesterol. This means when you have hypercholesterolemia, and some of you may have this position, then when the lipids are very high, they deficit in certain areas of the body, and they do this especially around the eyes, and this is what Mona Lisa has. She's quite young, but she has hypercholesterolemia. So when you next time come to Paris and you have nothing else to do and you go there, you stand there for the first time, you'll see that she has this disease. Now, one sign doesn't make a disease. We have a suspicion. We are not convinced yet. So let's go back to the hand. And we have already seen, a sharp observer, that she has this little swelling here. And this swelling also comes from the deposition of lipids. When we enlarge it a little bit, you can see it very clearly. And when you compare it to this condition, also deposition of lipids in the skin. So Mona Lisa has not only the xanthelasma of the eye, but she has also xanthoma, which is also deposition of cholesterol-rich material in skin or tendons. Sometimes we have it on the Achilles tendon. Some patients have it even here on their on the palms of their hands. But now we have two signs, and I think we can make a diagnosis out of that. We can say, well, most likely Mona Lisa has hypercholesterolemia. These days, we will not go into that, she could have been treated with statins. These lesions can be removed, and but they're not by chance. Leonardo knew exactly, not the disease, but that what he was painting, he took it seriously. When we look at